Hello everyone. This presentation covers material from our research analysis paper on California Senate Bill 277 dealing with vaccinations. Our group name is Marco Polio with team members Tyler, myself, Robin, and Sarah. In this presentation, we'll give a brief introduction and problem statement regarding Senate Bill 277, a little bit of background regarding vaccinations, its history, and its usage. We will talk about key stakeholders, people who were affected by the new law, some of the policy models that were utilized in developing Senate Bill 277, as well as evaluations of the outcomes from the passage of the bill, and some recommendations to further improve on the Senate Bill 277. And finally, we'll end with some biblical integration on Senate Bill 277. In the United States, vaccination requirements can vary depending on which state you live in. Here in California, they require vaccination on all children who attend public school, private school, or any daycare facility. So while vaccinations have become a common practice in the United States, there was a paper back in 1998 that was published in The Lancet where Dr. Wakefield and some of his colleagues made a claim that there could be a linkage between vaccines and the onset of autism. This paper has since then been retracted due to its flawed and inaccurate studies, but the damage was already done. Ever since the publication of that paper, there has been a steady decrease in vaccination rates, especially among young school children over the past 15 years. And back in 2014, there was only a 90.4% of kindergartners who were fully vaccinated for their required vaccines. So this growing movement of parents and guardians not wanting to vaccinate their kids have given them the title or name of anti-vaxxers. And this was pretty much done, or the cause of this was because of the misinformation from this 1998 paper. And so the state knew and saw this trend of increasing unvaccinated children attending the school system. So in 2012, Assembly Bill 2109 was passed and aimed to deal with this declining vaccination rates. But unfortunately, Governor Brown weakened the bill and allowed for religious exemptions. And because of that, there was an increased usage of personal belief exemptions, which allowed parents to prevent their kids from becoming vaccinated. The issue of declining vaccination rates among California school children came to a head during the Disneyland measles outbreak that occurred in December 2014. During this outbreak, there were over 150 people who became infected, and the last reported case came in February 2015. This outbreak was able to cross state borders and affected residents of California, Arizona, Colorado, Nebraska, Oregon, Utah, and Washington. And not only was it able to cross state borders, it also crossed national borders and affected residents of Mexico and Canada. So obviously from this outbreak, we can see that the current policy at the time was not working. Again, the main reason was because of the false and misleading information from the 1998 paper linking vaccines with autism. And weirdly enough, the affluent communities were affected more from this misinformation, and there was higher percentages of unvaccinated children amongst those affluent communities. The response to the Disneyland measles outbreak was California Senate Bill 277, which contained more strict vaccination guidelines. And its most powerful change to the vaccination law was its elimination of the personal belief exemptions. Because of overwhelming support for the bill, it passed both houses relatively easily in the California legislature, and Governor Brown signed the Senate bill into law in June 30th, 2015. The primary opposers or people who opposing the bill were concerned parents, and they were afraid that the bill was taking away parents' rights to do right by their children. A little background on the history of vaccines. So the first successful vaccine was developed in the 18th century in 1978 against smallpox. Back then, smallpox was very contagious and often very deadly. So the fact that we were able to develop a vaccine to not only fight off but prevent the spread of this disease was was viewed as a great human achievement and medical achievement. In the 19th century, further vaccines were produced for against rabies, typhoid, and cholera. Many more vaccines were developed in the 20th century, 21 vaccines approximately, some of those for measles, mumps, and rubella. And even now in the 21st century, there's continued research and development for production of newer vaccines to fight off other diseases. And this is made possible thanks to technological breakthroughs such as genetic engineering. So I remember when I was moving on from elementary school and moving into middle school, taking with me to the doctors my immunization card so I could get my required vaccinations to enter middle school. So a lot of us don't realize that there's actual people who come up with these required immunizations and timelines for the best efficacy and effectiveness of vaccinations to prevent diseases to be spread amongst populations in schools. And there's a committee underneath the Department of Human Health Services called the Advisory Committee on Immunization Practices, where they study, review, and do a lot of in-depth research on vaccines and recommend which vaccines should be used or mandatory for people to take. One of the best part of getting vaccinated is this thing called herd immunity, where when 94% of the population is vaccinated against certain communicable diseases, it ensures that diseases aren't able to spread amongst the population. And vaccinations, since their implementation, have saved millions and millions of lives. And according to the World Health Organization, 20.3 million measles-related deaths were prevented simply from the dates of 2000 through 2015. And here to the right, you can see what the pictures depicting herd immunity, where you have a population of people who aren't vaccinated. There's no immunization for a certain disease. You have one person who's contagious, and as they come in contact with susceptible individuals, then they end up spreading the disease amongst the population. As opposed to when people are immunized against certain diseases, you have a person who's contagious and they're next to next to immunized individuals. They're not able to spread the disease readily. So disease does spread, but very minimally, and it's able to be controlled. There are many key stakeholders as a result from Senate Bill 277. Biggest group is probably parents, and the largest vocalized group are the ones against the new law, and they state because they feel like their parental rights have been removed. Physicians are also affected. There's been an increase in people demanding or requesting medical exemptions for their children to prevent them from getting vaccinated. Children are also stakeholders. Children who are not vaccinated are not allowed to go into public or private institutions and are forced to attend private schools, which eliminates their access to child-to-child interactions. And school administrators are now required to be more on the enforcing side of the new law and are denying school access to children who do not present the proper vaccination records required to attend the school. So policy models are used to address how policies have been formulated, implemented, and evaluated for certain issues. In most cases, policies are rarely conform to a single model, and Senate Bill 277 is no exception. It actually utilizes 4 different models that we talk about. The first policy model is Kingdom's multiple streams approach, where there's a clear problem, the Disneyland event, where unvaccinated children became infected with the measles. The policy details of Senate Bill 277 were already in place after Assembly Bill 22109 was not fully implemented by Governor Brown. And the politics behind it, California Senator Allen was a strong supporter and has been a strong supporter of vaccinations and co-authored the bill. In our analysis of Senate Bill 277, some aspects of rationalism was observed. While it's hard to be 100% rational, it's still important to use rational thought and thinking to approach certain problems and to come up with solutions. One of the most relevant was the ability to weigh in society's values and preferences on the issue. And obviously, there is a higher and more weighted value on the people and society's side for pro-vaccination. Most policies probably utilize incrementalism, where small changes or additions are made to existing policies over time, and Senate Bill 277 was no exception. It built on top of previous vaccination requirements, and simply the main change made from Senate Bill 277 was the elimination of the personal belief exemptions, which is expected to greatly improve and increase vaccination rates. And finally, group theory model was utilized in Senate Bill 277. Both supporters and those opposed to the Senate Bill 277 use group theory, where they press their demands on government officials in order to try and sway direction of the bill and objectives to their viewpoints. The full intended effects from Senate Bill 277 won't be witnessed immediately, due to the grandfather clause included in the bill, which allows children with non-medical exemptions to continue on without the required vaccinations until they reach their next grade checkpoints, which are kindergarten and the 7th grade. So until this wave of children move out of the school system, which will be in 8 years, then the full intended effects of the bill will be observed. But initial statistics and data show that there is an improvement of vaccination rates. From comparing from years 2013-2014, their vaccination rates were 90.2% of kindergarten children were vaccinated, whereas after the Senate Bill 277 passed, from 2016-2017, vaccine rates jumped up to 95.6%. So initial good results from the passage of Senate Bill 277. And here are some graphs to illustrate the evaluation of outcomes a little bit better. So from school years 2011-2018, we see the percentage of all required immunizations being held by school children. So you see after the passage of Senate Bill 277, there was a significant increase in vaccination rates among school children. However, I would like to note the difference between private, green line, and public, red line, in their vaccination rates. Again, there's this weird situation occurring where affluent communities, people who attend private school tend to be better off. So these affluent communities tend to show lower vaccination rates for some reason. So some recommendations. The idea behind Senate Bill 277 is sound, but there is still room for improvement and change. Ever since the passage of the bill and its elimination of personal belief exemptions, there's been an increase of requests for medical exemptions from physicians. And the problem with this is that the way that the law is currently written is that any physician can write medical exemptions, including physician's assistants and nurse practitioners. Here's a graph showing the increase of medical exemptions being utilized after the Senate Bill 277 passed into law. So there's definitely an increase in the usage of medical exemptions, since now parents or guardians aren't allowed to use personal belief exemptions. And again, I like to just show or point out the difference between private schools versus public schools in red, in that affluent communities or affluent households continue to show increased low vaccination rates compared to public institutions. So finally, what can California could do? They could look at Mississippi and West Virginia, where in those two states, all medical exemptions are reviewed by state health officials, and they have the authority to invalidate medical exemptions if they deem necessary, and they are able to revoke the authority of physicians to provide medical exemptions if they abuse the system. And finally, Senate Bill 277 medical exemption loopholes should be closed. And until then, California should just monitor the number of medical exemptions being utilized every year. Biblical integration can be viewed from both sides of Senate Bill 277. Those that oppose the bill due to the fact that it takes away parents' rights can look at one of the 10 commandments, honor thy father and thy mother. So by taking away a parent's right to deny vaccinations, are we taking away their Christian right to be parents and to decide what's in the best interest of their children? Obviously, parents aren't opposed to vaccines because they want their kids to get sick. Obviously, they want the best for their kids, and the reason why they're opposing vaccinations is because of misinformation that they've heard or come across in some of the material that's found in these vaccines and the linkage between vaccines and autism. And on the other side of the aisle, here we have, as a pillar of faith, Jesus commands his followers to love thy neighbor. So we all want the best for our neighbors, and we need to treat each other with respect. We also have the golden rule, do to others as you want to do unto yourself. Obviously, we have to look out for one another and do what's best for society as a whole. And in this, vaccinations do provide a herd immunity and help protect the community as a whole. And there are situations and individuals who are medically unable to obtain vaccines. So the more people that are able to get vaccines and are vaccinated, the more protection we have for those individuals who are not able to get vaccines because of medical exemptions. Finally, here's a list of references we used in our policy analysis, and we hope you enjoyed our presentation.